Breast cancer is a widely known disease with no known effective cure, making it an interesting biotechnology with current research to delve into. Breast cancer is the abnormal and out of control growth of cells in the lobules, ducts, or connective tissues of the breast. It is estimated that 99% of breast cancer sufferers are women, and it very rarely affects men. However, according to the National Breast Cancer Foundation, the disease can be more lethal to men. Statistically, breast cancer is the leading cause of cancer-related death in women, and it makes up about 15% of all new cancer cases in the US. In 2016, approximately 250,000 people were diagnosed with invasive breast cancer. Invasive breast cancer can travel from the breast to other parts of the body. There were approximately 40,000 deaths related to breast cancer in 2016. Overall, the survival rate over a 5-year period for a breast cancer sufferer is 89.7%. However, this number differs drastically across the different stages of breast cancer. Here we have a breast stem cell dividing into its various other cells in the breast tissue. We can see that each cell gradually specializes more and more into the final type of cell that it will become. In our case, it's a luminal progenitor cell that does turn cancerous. So we can see the formation of that cancer cell as the cancer cell embeds itself into the breast tissue. You can see the other cells have begun to die off as in their normal cell cycle before the cancer cells start to reproduce and grow into a tumor in the breast tissue. These changes and mutations to the DNA of normal breast cells can be either inherited genetically or acquired through lifestyle choices. Cells that have become cancerous generally tend to reproduce uncontrollably, but there are multiple types of breast cancer, and different types will reproduce and spread at very different rates. One thing they all have in common is that all types of breast cancer can spread to other parts of the body by moving through the lymph or the blood vessels.
Breast cancer is not just one disease. There are many different types of breast cancer, and breast cancer really can present as any one of a spectrum of different syndromes. We subdivide breast cancer based on the cell of the breast, which is the cell of origin of the tumor, and we divide those types of cancers into ductal and lobular cancers. The ductal carcinomas arise from the ducts that are inside the breast and that carry the milk from the lobules to the nipples. Lobular carcinoma is a cancer that arises in the lobule. That's one way to differentiate breast cancers, but really the most important way for us to think about the different types of breast cancer is to look at the biologic characteristics of these cells. A very important difference between breast cancer subtypes is whether or not those cells in the tumor have receptors for the hormones estrogen and progesterone. We call that ER and PR. So if a tumor is positive for these hormone receptors, estrogen receptor and progesterone receptor, that tells us that this is the type of cancer that may have developed because of some hormonal factors in a woman's body. And also, this is a very good biologic target for us in the treatment of breast cancer.
While it is supported by most world governments, breast cancer research is mainly funded by many private charities across the globe. The Breast Cancer Research Foundation is one of the most prominent of these organizations, having just this past year announced the investment of $66 million into research across 14 different countries. Modern research on this disease is scattered across a few different main topics. One of the most significant of these is breast cancer detection, a section that is specifically focused on finding the disease as early as possible in order to increase the chances of recovery. Here we see radiologists from Stanford explaining different types of early detection technology that are currently used and being developed.
There are many ways of approaching breast imaging, and because there's so many technologies, people get confused.
The standard screening method for women is the X-ray imaging of the breast, or mammography. Mammography is fantastic at identifying little tiny white dots on a mammogram which represent calcifications, the earliest stage of breast cancer. A weakness of mammography would be in the setting of a woman who has very dense breast tissue. And that's because dense-breasted women have mammograms that are almost entirely white. And so cancer, which is also often seen as a white abnormality, is harder to detect. That said, it is still a very good test for screening all women and has been shown to reduce mortality from breast cancer.
Another way of looking for breast cancer is with breast ultrasound. Although mammography can find many breast cancers, sometimes ultrasound actually will find others. The problem is that it will miss those little calcium particles. There's other ways of looking at the breast besides mammography and ultrasound. One is MRI. And MRI uses strong magnets to look through the breast tissue. Those cancers will light up bright, and so it will show us little cancers that can't be seen any other way. But I ought to say, you can't just get the MRI. And the reason is because it will miss the earliest form of breast cancer shown by mammography and calcifications.
We'll take this lateral picture. There's a new technology called 3D mammography, or also called tomosynthesis, and it's something that we've just recently started offering at Stanford.
Take in a breath and hold it.
In the early clinical trials, the data has shown that this new technology decreases false positives and increases cancer detection, regardless of a woman's breast density.
And it's been shown in studies that tomosynthesis can increase the detection of breast cancer by about 25 to 27%. That's huge. Plus, it decreases the number of false positives between 15 and 17.
Clearly, there are many ways of detecting breast cancer early, but as we just learned, each method has its own strengths and weaknesses. One new method that is being developed in order to be a sort of cure-all for breast cancer is individual treatment for each patient based on their biological makeup. Other tools being developed or applied to fighting breast cancer include CAR T-cell therapy and CRISPR gene editing, among others. But these treatments are far from being mainstream at the moment. For now, different radiology techniques are the most efficient in the battle against breast cancer.
Risk factors. Personal history of breast cancer. A woman who had cancer in one breast has higher risk to develop cancer in another breast. Family history of breast cancer. A woman to develop breast cancer double the risk if she has a mother, sister, daughter who had the cancer under 50 years of age. Genetic risk. Genetic women who carry certain mutations in the genes have higher chance of developing breast cancer, ovarian cancer, or both. Other factors. A person starting their period earlier, a person who enters the menopause at later than average age, not having children, having kids at older age, or having a first child, or hormonal treatments. Lifestyle factors. Body weight. Women who become overweight or develop obesity after menopause. Physical inactivity. A high-fat diet. Treatments for breast cancer is based on the type and stage of the cancer. That involves surgery, radiation therapy, chemotherapy, and hormonal therapy. Localized tumors are removed circularly by partial mastectomy, where the affected part is removed. Enlarged tumors, which are spread by tissue, are removed by total mastectomy, where the entirely breast is removed. In addition, nearby structures like lymph nodes may also be removed if the cancer has metastasized. Hormonal therapy is used when the tumor cells have hormone receptors like estrogen and HER2, and may include medications that block the formation or effects of the estrogen. Radiation therapy involves targeting the tumor with controlled doses of radiation that kills any remaining cancer cells. Chemotherapy. Chemotherapy before surgery works to shrink the tumor and make its removal easier.